A healthcare professional may recognize the possibility of child sex trafficking by certain indicators that may or may not be present. If a child is in the company of their trafficker, the trafficker may be a very kind of aggressive, domineering personality who speaks for the child, intimidates the child, and clearly has a domineering effect over the child. The child may seem intimidated and afraid. Another possible indicator might be that a child comes in with other children asking for sexually transmitted infection testing, for example, or pregnancy testing, or HIV testing. There are certain risk factors that may clue you in to the possibility of child sex trafficking. Among the most common risk factors we see are runaway status, a prior history of sexual abuse or sexual assault, and a prior history of involvement with Child Protective Services. Many of these children are very troubled. They're running away from a very dysfunctional family. And so encountering these risk factors while you're talking to the child and obtaining a social history may clue you in that this child is at high risk for trafficking. Other indicators may be how the child presents. They may present with a history of a sexually transmitted infection. They may have a history of a prior pregnancy and be in their teens. They may provide a history of running away from home, or a prior history of sexual assault, or a prior history of involvement with Child Protective Services. These are all very prominent risk factors. There are certain red flags you may encounter during the physical examination. In some cases of sex trafficking, the traffickers will actually brand their victims in the form of tattoos. Now, these tattoos may be the tattoo of a trafficker's name, their street name, for example. It may be a gang insignia, or it may be a sexually provocative phrase. So if you encounter a tattoo, it helps to ask the child a few questions about the tattoo in a very non-threatening way. Other physical indicators may be evidence of old or new injury that appears to be inflicted. That is, it has a pattern to it, or it may be located on areas that are protected areas of the body. For example, the neck, or the torso, the inner thighs, the upper arms. And that's another indicator.